Hey friends, welcome to another episode on job-related distress, what is commonly referred to as burnout. This is Rajeev Kurapati. I'm a hospital physician and we are talking about burnout in healthcare. In fact, I prefer the term job-related distress than the non-specific term burnout because burnout almost implies as if it's an individual problem, as if the individual is weak, as if the person is unable to deal with his or her job, as if they are not adequately trained or not coping with or not thriving well despite all the things that are provided to them. It is almost a misunderstanding. The word itself is plagued with certain misunderstandings, but because the word job-related burnout is such a long word, a bunch of words, so they had to come up with something simple. And about 30 years ago, certain researchers came up with the word burnout and defined it in a particular way. It doesn't mean that this definition of burnout, the way they defined it, is by using the terms depersonalization, emotional exhaustion, and functional performance decline, the decline in functional performance. These are the terms that they use to define burnout. But it doesn't mean that that is all there is to burnout, because they had to define it in a specific terms so that they can do certain research on it. See, unless you define it, you can quantify it, you cannot do any research on it and come up with any solutions to it. So they have a working definition of burnout, which is the job-related distress that results in depersonalization, emotional exhaustion, and diminished functional performance. But remember, this is not an individual problem. This is not because the individual is weak or individual is whining or complaining. It is a systems problem. So when you look at solutions to this burnout, you have to look at, although it is not solely an individual problem, because the systems are created by the individuals, you have to address it from an individual level and at the organizational level. It is not enough to just say somebody out there is responsible for my burnout. It doesn't work that way, because the systems that were the superstructure we have created in the form of policies, procedures, guidelines, standards of care, licensing requirements, and so on and so forth. All the entire superstructure we have created in the name of safety and accuracy have caused a lot of distress to the people at the ground level, to the people on the front lines. So although the word burnout is kind of misleading, we still use it for our purposes, very well understanding that it is actually a job-related distress. So in this episode, we'll be discussing about the individual causes of burnout. Again, when you look at the individual causes, I mean that the systems are created by the individuals, and now change has to come from within the individuals to change the system, whether it is the medical professional in the front lines, either the nurse or a physician or a surgeon or an anesthetist or a nurse practitioner or a social worker or the pharmacist or care coordinator. And many different names given to all the people that are involved in the direct patient care, or on one side, the direct medical professionals involved in the direct patient care. And the other side is the administration, the leaders, the people that are making policies and creating guidelines and procedures and regulations and standards of care and protocols. These are the people on the other side. So they're still people, they're individuals, so change has to come from within. Change will only come if they understand the superstructure in which we are working. So if you come to the individuals, how individuals can improve their systems, the first thing is to, wherever you're working, the first thing is to identify what are the things that are the most pressing issues. Pick the low-hanging fruits. What is the three most important things that we have to change now to make our workflow easier on the people in the front lines, at the ground level in the patient care. So for example, if there are policies, you have to analyze, you have to work on the policies that are complicated, that are redundant, that are duplicate, that are conflicting with other policies, and weed out and improve on the systems and improve on the workflow of the policies. And then there are leadership skills that are involved. We talked about this in the organizational cause of burnout. Now coming to the individual causes, individuals who are leaders in the healthcare have to understand what really happens at the ground level. How can we go and improve them? How can they reach me? How can I measure the progress? Once I set a system, once I set a policy or a regulation or a procedure in place, what is the kind of feedback that, how do I get the feedback? And how can I change it? How can I improve the systems? And if the system and the policies and the procedures are not working, how can we tweak them? How can we improve them while keeping safety in consideration? So these are the things how an individual can actually affect the organization at the individual level. And the second is purely at an individual level. How can we improve our own lives apart from work? When I go home, when I'm detached from work, what's going on with my life? What is my philosophy of life? What do I believe in? How do I organize my leisure? This, I think, is the most important thing at an individual level, because look at leisure. Leisure, I mean the time that you spent after you are done with your chores and daily activities and work, and apart from those few hours in a week that are left to you. A lot of people are busy at home and at work, I understand that, but there should be at least a few hours in a week to yourself. And this time, either you call it free time or leisure, how do you organize it? What do you have in mind? See, when you look at work, your work is organized, it is structured, and you know when to go, when your work will be done, more or less. And you also know when you face any unexpected problems or surprises, who to ask for, what to look for. And this work that you do for most people, especially in healthcare. There are a lot of systems set in place, and this is quite structured and organized. But when you go home, and those few hours that you have to yourself, and that is the most unorganized time. Your mind, having gotten used to a structure at work, now goes home and says, give me something to do. And this leisure time becomes so much more important to organize your leisure. If your leisure is spent wasted, either wasted on continuous exposure to hyperstimuli like shopping and watching TV, or junk food, or just kind of wailing away, then you have missed out the most important part of your personal life. So organizing your leisure that actually enriches your life actually makes you a better person at work, because you are rejuvenated, you are coming back with much more vigor and vitality after having used your leisure time in a very productive way. Either you're traveling, either you're learning a skill, or either you're spending time, quality time with your family, or quality time with your friends. Either you are catching up with the skill or a hobby that you felt was left out because you got busy with other things in life. So make sure that you organize your leisure just like you organize your work time. See, for work, somebody else does for you, so it becomes rather easy. But for leisure, you have to do it yourself, and that leads to my third point, which is organizing the contents of your mind. So, see, there is an old Sanskrit saying that goes like this: Mana eva manushyanam karanam bandha mokshayoho. Mana eva manushyanam karanam bandha mokshayoho. What this means is, your mind is responsible for both bondage and liberation. So if you use your mind and if you organize the contents of your mind, it's going to help you in having a stress-free life and you can thrive both at home and at work. But if your mind is so disorganized, your life is obviously disorganized. So organize the contents of your mind in more or less a structured way. So in doing so, you have control over your life, and you have control over your work life and your home life. So these are the broadly, very briefly, some of the things that you can do from an individual level to thrive at work, to counter the job-related distress. Remember, job-related distress, you cannot blame somebody out there unless you do something and that is not really working. And then, of course, you cannot stay in that job if nobody's listening to you. It's a toxic workplace. You have to either cut down your works or find some other job and so on. But as long as you have not made an effort to change things at home, you simply cannot blame somebody else. Because most administration, most workplaces, most policymakers would like you to see, would like you to thrive, like us, medical professionals, thrive at work, do the best as what we are trained to do. And unless we make certain effort, there is nobody out there. The out there people are actually us who created the system. So change has to come from within. And of course, leadership is so much more important as much as the individual effort. So this is basically job-related distress or burnout in healthcare. So until we meet next time, remember, be good and stay healthy.